Hi everyone, and welcome to the video today. My name is Dr. A. I'm a small animal general practitioner, and today we're going to be talking about urinary health in the cat. And so urinary conditions in the cat are extremely common. Cats are traditionally or thought to be historically a desert creature, so you can think back to history class. A lot of the Egyptian art and pharaohs and things like that are surrounding or depicting cats. And so we think the domestic cat may have originally kind of occurred there in the desert. And so with that, they tend to hold on to and preserve water via the kidneys. And so the kidneys kind of work harder in the cat and really concentrate cat urine. So that's what gives it a lot of time that characteristic, really pungent odor. That on top of their high protein diet, you get a really, really pungent, strong odor. And that's the work of the kidneys. So the kidneys in the cat are kind of always working hard. And so with that extra work and with that increased kind of taxation on the system, we do tend to see some repeated issues going on and on. So the more concentrated the urine, the more potent that urine is, the more irritating that urine is, the harder it is on the urogenital system. We combine that, especially in male cats, with a really small penis, a really small urethra. We end up with some really serious conditions that can be life-threatening, like a urinary blockage. And so in this video, we're going to be talking about some of the common urinary issues we see in cats, and then some dietary considerations that you may want to factor into your decision-making process for your cat. Now, this is not medical advice. Some of these conditions are extremely serious and need to be dealt with immediately. And so I will preface this by saying, if you think your cat, if you're not using this video as a preventative measure situation, and you think your cat is ill, you really need to get that checked out and diagnosed and get on the right track. Because with anything that I talk about on this channel, any type of disease process, we are using nutrition to complement the treatment plan. It is not the sole treatment plan. There are some very select cases where nutrition can be the sole treatment plan, but we're talking about a holistic approach. And with that, it's very important to always get the diagnosis first and let nutrition be part of that treatment plan that you discuss with your veterinarian. So a lot of the things that I'm going to be discussing today are in this workbook. I was asked to create some workbooks with the information, quick reference for you guys on a lot of the things that we talk about repeatedly in my videos. So the first workbook I came out with was the dog workbook called The Reasons We Feed. And then from that spiraled a similar book, but tailored to cats, called The Cat's Butler, because, you know, we are all our cat's butlers. And so this is going to be information that is from chapter 12, which is species-specific concerns, and it has a chart here with the information that we're going to be going on, and then there is, you know, a little blurb on urinary tract disorder. So very good book, and it will have QR codes that link back to a lot of these videos so that you can also have a video reference. So check that out. It'll be linked in the description box below. And again, it's going to be going over a lot of the things that we're talking about this video, as well as other nutritional, beginner nutritional concepts for feeding your cat. So urinary disease, what are the common ones that we see? Well, you've got your straight up urinary tract infection. So bacterial infections cause inflammation, they cause pain. What people will notice most commonly are inappropriate elimination. So your cat goes to the bathroom in your sink, it goes on the rug, it goes in my instance, okay, don't tell my husband, okay? He doesn't really watch these videos, so he's not gonna hear this. So a long time ago, I had a cat that I adopted from the clinic that I was working at. It was an old lady's cat, and she was boarding, and the old lady ended up passing away in the nursing home or the rehab center. And so the cat was living in the clinic for a long time, going through legal, like what happens with the cat and releasing the cat. So anyway, eventually I ended up with this little old cat named Mary Beth, and I felt bad, so I took Mary Beth home, and she had her litter box, and, you know, in the laundry room, or a lot of people keep their litter boxes. Well, one day Mary Beth decided to have a urinary tract infection, and she inappropriately urinated in my husband's gym bag that he kept in the laundry room, and she urinated in his shoes. Now, he was not a fan of me bringing the cat home in the first place, but he was just like, well, whatever, if you take care of it and it's not a problem, I don't care. But you know, he wasn't a fan in the first place of bringing the cat home. So she urinated in his gym bag. Well, I did a really bad, this is a confession time. I did a really bad thing. See, my husband has no sense of smell. He was born like that. And so I didn't know she did it at the time, but he came to me, he goes, I don't know what happened, but my shoes are all wet and my gym bag. Do you know what happened? So of course I run in there and I smell it, and I know immediately, because again, cat urine has that really pungent odor. And I was like, oh no, I don't know. Maybe they're just sweaty from your workout or something like that. And the reality is, I did know Mary Beth had urinated in his gym bag, even though it was like right there next to her litter box. She had PB'd in his gym bag, and it was the first sign of her having a urinary tract infection. And so inappropriate, long story short, in confession time, long story short, inappropriate urination in weird places, frequently posturing to urinate, so getting in and out of the box and maybe only producing small amounts. Obviously, if they urinate and you see things like blood in the urine, that's going to be an indication of a urinary tract infection. And so in those instances, yes, absolutely, those are bacterial. You need to get them into the clinic, and you need to get that treated. I hear a lot of times trying to use supplements like cranberry and things like that to treat a urinary tract infection. They do not. Okay, they do not. If your pet has a urinary tract infection, bacterial infection, please, please, please get them into the clinic and get the appropriate antibiotic. We will do a urinalysis, we will do a culture, and we will get them on the right medication. Those alternative means for clearing urinary tract infections do not work, and they prolong really painful condition. And so if that was you, you would want to get rid of that pain and that burning right away. And so let's do that for our pets. Let's get them in and let's get them on the correct treatment. Sometimes it's a pill, sometimes it's a liquid, sometimes it can even be a shot. And so we can even get them on some pain medications as well. So that is, number one thing we see with urinary health is going to be by far urinary tract infections. The second one is a really important, life-threatening. You need to do not pass go, do not collect $200, go straight to your vet if you see this. And this is a urinary obstruction. This primarily occurs in male cats because their urethra is very small. It can be caused by infection. It can be caused by stones, which is what we're going to be talking about today. It can be caused by mucus buildup, or it can be caused by just inflammation and spasms. And what happens is the urethra actually closes down. It's either blocked or spasmed shut, and your cat cannot urinate. It does happen in females, but it is absolutely more prone in males because of the anatomy. And if your cat cannot urinate, that is a life-threatening emergency. The bladder will continue to fill and continue to fill and continue to fill. Eventually it could burst. I've heard of that happening. I have never seen that happen, but it could burst. Just you picking up your cat when it's blocked, or your veterinarian just palpating the abdomen, or even trying to draw a little urine off, it can burst. And that is not anybody's fault. That is the fault of the obstruction. And so that is a very serious condition. If your bladder obviously ruptures, it's very painful. All those toxins and probably bacteria are now swimming in the abdomen, and you have a very, very, very substantial emergency that obviously could cause your cat their life. Before that, though, if you catch it early, it hasn't gotten to the point of bursting and we're treating it, the other thing that happens despite the pain and the risk of burst is all those toxins that are being backed up essentially into the kidneys and into the bladder getting reabsorbed to the system. So you get really severe life-threatening electrolyte disturbances, as well as increase in your kidney values and things like that can be permanent. But a lot of times when we reverse the obstruction, we can get those back to normal if we've caught them early enough. Sometimes with obstructions, we will always have some degree of incontinence for a short period of time or permanently if those sphincters are damaged. And one of the big things with these life-threatening electrolyte disturbances, they can actually get a really high calcium. If calcium gets high enough, it can actually stop your cat's heart. And so if your pet is frequently, if you have a male cat specifically, you need to be really paying attention, but if you have a cat that is going to the litter box frequently and posturing to go to the bathroom and is not producing anything, poop or pee, going to the litter box and posturing and nothing is coming out, especially if they're howling or doing it repeatedly, you need to get into your vet ASAP. A lot of times people will call our office and say they think their cat is constipated because they've been going to the litter box for 2 or 3 days, trying to poop and nothing has come out. Yes, cats can get constipated, but almost 9 times out of 10, when somebody calls with that complaint, the cat is actually blocked. And so to the untrained eye, the people that aren't familiar with palpating a cat's bladder, going to the box repeatedly, to them, the first thing that comes to their mind is constipation. And although that can happen, it is more likely and more dangerous that your cat has actually got a urinary tract infection. So when somebody calls our office and said they think their cat is constipated, we will often say, come now immediately. We would rather be on the side of caution and make sure your cat is not blocked, especially if this has been going on for a few days. You need to come now so that we can see if the bladder is full or not. If the bladder is not full, we can, get you an appointment scheduled. We can take care of it. Or if it is, you're going to be here for an emergency visit, and we're going to have to work on this straight away. And so, if you think your cat is constipated, I would err on the side of caution and try to get in ASAP, because they could be blocked. And I venture to say you may even want to go on emergencies. Better safe than sorry. If it's in the middle of the night, you need to go to the emergency clinic and just be sure that it is constipation and not a blockage, because time is of the essence. So there are things that we can do for urinary blockage. We pass a urinary catheter, we remove all that urine. A lot of times we'll leave an indwelling catheter for several days to try to get the inflammation down so they do not re-obstruct. Re-obstructing is a common thing. That's why it is very important that after an obstruction, we include nutrition in our dietary management of that condition. And, we can get them through it. We just had a little cat we discharged, male, orange cat, classic. Actually, the cat was only 2 years old. I fixed a foreleg fracture on it when it was a kitten. So this is a life that this kitten is. Just free kitten has just spiraled for these people, but he's a great cat. Had an obstruction, blood levels of kidneys and everything were off the chart. Released the obstructed, did some medications, fluids, dietary modification, and a week later we were able to get all those values back to normal. So yes, time is of the essence. We can fix it. And so do not delay. The third type of urinary tract issue we see commonly, and it's changed names a bunch of times, is the idiopathic cystitis. Used to be called fluted, now it's called something else, feline lower urinary tract disorder. Now it's called feline interstitial cystitis, or FIC. There's a lot of different names for it, but basically what it is, it's an inflammatory condition. So it's inflammation in the absence of any type of infection. And so the bladder is just inflamed. That inflammation can lead, if there's enough inflammation, to obstruction. But that obstruction can simply be just from the inflammation alone, or it could just be inflammation and pain where they're frequently visiting the box and trying to void, and very little amounts are coming back. They're not obstructed, but they feel that urge constantly, so the bladder never fills. It's just as soon as a little bit of urine is made, they want to go void it because it hurts or it burns. And you will also see the signs of inappropriate elimination, or frequent small, like quarter-sized drops in the litter box. And I said that was the last one, but it's not. I'm going to lump in here urinary tract stones, which can cause all the same symptoms: blockage, bacterial infection, and inflammation that can result in cystitis. And so stones are actually stones. They look like pebbles. They literally are very similar to if I go out to my yard and I pick up a piece of the river rock pebble. They literally are stones. They are mineral deposits. And so how do you manage your pet's development of mineral deposits? You largely manage the minerals. And so we're going to be talking about that today. Stones can, depending on the type, there's about 6 different types of stones. Depending on the type, the most common are struvite stones or calcium oxalate. Stones can actually be multiple things. So we always send our stones that are retrieved to the lab to see what they're made of, so we can better treat them and better treat them with diet. So you could have a calcium oxalate center, but a struvite outer portion. And so there's different stones, and then the body can mix and match and do little composite stones. But those can be removed or dissolved depending on what type of stone they are. So again, that analysis is key. So today what I thought we would do, now that you guys have the necessary prerequisite to this video, we're going to go through a couple diets. Information on urinary tract disease, again, is in my little workbook, or you can read the unabridged kind of version in Small Animal Clinical Nutrition, which is linked for free in the description box below. And so there is a chapter on urinary health, so feel free for more in-depth information on that in that textbook. So 3 diets we're going to do today. I'm going to do the Purina ONE Urinary, so just your regular over-the-counter urinary you can pick off the shelf. It's a pretty popular one. It's one of the ones most commonly that I hear in my practice that people pick. You can get it at Walmart, you can get it at the grocery store, you can order it online, very budget friendly. The second one that I'm going to do is the new Urinary and Hairball Hill Science Diet. Canned and dry for both of these, canned and dry for the Purina, canned and dry for the Purina, or the Hill Science Diet, the new one. I got asked about that. And then the last one we're going to do is the Medicus, because I wanted to do kind of a expensive boutique-y one. And all of these companies had the information on their website. So those are the 3 that we are going to do today. Ideally for all cats, but specifically cats with urinary tract infection, if they will eat a wet diet, they're going to be better off. Now, all cats will not do that, and that is not feasible for everyone's lifestyle. But if you have a cat with urinary tract disorder, increasing the moisture is really important. And so canned diets can be exceedingly helpful. If you don't do a canned diet, your cat's not going to, you can only do what you can do. So there are some people like, my cat won't do it, they won't eat wet food. Okay, that's fine. We can think of other ways to increase their hydration, maybe adding some HydroCare, or adding some fountains, or adding just simply water or broth or something like that. So canned ideally is the most convenient, but if you can't do that, don't beat yourself up about it. We do the best that we can. So we're gonna open up the screen capture now, and we're gonna start out with the Purina ONE Urinary Tract Health Beef and Liver Recipe Premium Pate cat food. And this is the pate, so this is going to be the canned version. Now, when we use canned versions, we do have to do a dry matter basis conversion. I could have called the company and got it, and ideally you would do that because these are minimums and maximums. But this video, I'm not so much doing a diet review. We're not going to be going through the entire PSS system. I'm more showing you specifically what you need to be focusing on, and then you guys can run the full PSS system. On a side note, for PSS systems, I did alter it in the cat book for the cat. So the PSS system for the original one that I made was kind of all-encompassing, and there are some things that aren't exactly. I wanted to tweak it a little bit for the cat. So I've substituted in the cat the grain-free situation, since there's not a whole lot of data on that, and years have come and we still haven't really got a whole lot of data on the grain-free thing on the cats. I've substituted that with appropriate taurine level, because that's really important. So we know a lot of the grain-free things have to do with taurine, and so for the cat I'm specifically including taurine, because that is an essential amino acid for them. So when you, if you get the workbook, you will see there is a new specific PSS system for the cat that differs from the dog, and its own scorecard that is different from the dog. So anyway, we're going to be using numbers, and I'm going to read through them really quick from the chapter 13, and these are for the adult. Okay, so I don't know that there are very many kitten formulas that are going to be in these ranges, so this is specifically for the adult. So according to Small Animal Clinical Nutrition, and this is from the data and the research that's referenced in that textbook, for ideal optimization of your cat's urinary health, you should be shooting for protein between 32 and 45. You should be shooting for calcium between 0.6 and 1, phosphorus between 0.5 and 0.9, magnesium, because that's a common component of urinary tract stones, between 0.07 and 0.14, and sodium between 0.3 and 0.6. They also included omega fatty acid, measurement. This is a harder one to achieve, but I'm just going to throw it out there. They also suggest that you feed a diet with omega-3 fatty acids between 0.35% and 1%. So those are the numbers that we're going to be shooting for today, and see which of these diets kind of meets the mark. And again, these are minimums and maximums, so they could be more. So if you're interested in this diet, you do need to call and get the absolutes. But we always have to convert this to a dry matter basis. Now down here you can see it says the Purina ONE Urinary Tract formula, again, is for maintenance of adult cats. So I don't think there are going to be very many that can meet these nutrient requirements because of the lower calcium and phosphorus and still be appropriate for a kitten. So you may have to make this transition after your kitty is 12 months old. All right, so let's move into the nutrients and see if we can get them down to where we want them to be. So the protein minimum, and let me pull up my Excel spreadsheet conversion chart to help us do the conversions. I could do them by hand, but just for speed and ease here, we're just going to use, and there are lots of calculators online too, and I have an entire video you can use to learn how to do that. It's also in the workbooks how to do these dry matter basis conversions by hand. But there are a lot of calculators online, and you can simply just call the company to do it as well. So let's move this. Okay. So first thing we need to do is I need to plug in the moisture, and the moisture of these diets, as our most canned diets, are going to be high in moisture, so it's 78%. Protein, as fed, they're saying 10. Fat, they're saying 7. Fiber, they're saying 0.5. Calcium, they are not listing the calcium on this particular diet, so we're not going to have the calcium, but I will go ahead and substitute that for the magnesium, 0.024. The phosphorus, they are not listing, and you'll see this too on a lot of these diets. You're going to have to call a lot of times to get this information. They are not listing, but we will substitute that for right now for the taurine. You will find also on some of these more budget brands that it is a little bit harder to get this information, and they're not necessarily selling through veterinary channels. So veterinarians a lot of times will want this information. So veterinary prescription diets, this information is more readily available, but you will find it is a little bit of a drawback on the budget. You may need to do a little bit more work on the back end to get the information that you need. Okay, so we wanted ideally the protein to be between 32 and 45. This is a little bit over. It's at 45.45, but still pretty decent. Fat for the cat, we know that cats need a higher level of fat, and so let me pull up just the regular chart for that information, because you still want the other parameters that we normally use to fall in line with the small animal clinical nutrition for adults. So let me pull up the cat here. I'm one of those people that has a million windows open, and it drives people crazy. At work, we have our practice management software, our record keeping software. You can only have 4 windows up at a time, and I always exceed that, and I have to shut a bunch. So guilty on that one, since we're having confession time today. So fat, we went between 10 and 30, and this was pretty darn close and was right there, so we're happy about that. Under there. The next one we're looking at, like I said, the calcium was not listed. You're going to have to call and get that. The phosphorus was not listed. You're going to have to call and get that. The magnesium, we wanted between 0.07 and 0.14, and we substituted the calcium here for magnesium, and it's coming in at 0.1, so we are good on the magnesium. And then the phosphorus, we want ideally between 0.5 and 0.9. This came in at 0.2. Fiber, we want less than 5. It's coming in at 2. And then taurine, this phosphorus was not phosphorus, so it was taurine. I'll plug in the phosphorus. The taurine, we want between for any cat, we want between 0.1 and 0.2. This is 0.22, so that's fine. You can have a little bit more taurine, and that's not going to hurt you too much in that department, so that's good. And then, sorry, let me get back to the phosphorus. The deal was they didn't list the phosphorus, so we can't check that. So what I would do on this diet, it seems like the two minerals that were really important for cats with urinary tract disease, the potassium and the magnesium, or excuse me, the magnesium, which is a really big one for magnesium ammonium phosphate crystals, was appropriate in this one. You do need to make sure you check the calcium and the phosphorus, and so you would want to email them and double check on that, but it looks like the magnesium is good, which is a major player. Okay, you know what? Actually, through the magic of film production, I think I'm gonna try, just while we're here, let me see if they have like a chat bot that I can do to get that information. Okay, they're gonna get this information for us. So that's gonna be pending here for a minute. But as you can see, what we're really striving for with these urinary diets, on top of the other things that we're already looking for with the regular PSS parameters, is that magnesium, potentially sodium, potentially omega-3 fatty acid content as well. Let's look really quick while we are waiting on this. Oh, she's gonna send me an email. Okay, yeah. And I do have a Purina book, but I believe it's just the Pro plan, so I can't look up. I didn't want to do the Pro plan just because I wanted to do like a grocery store accessible one. Let's pull up the dry matter one. It's got more of the numbers. I don't know why the can was a little bit skimpy on the numbers. I guess I didn't really pay attention to that. I just assumed the two were correct when they were not correct. There is less information on the pate for whatever reason. And hopefully my computer will beep when she gets back to us. So again, we're looking for the same parameters, and you can see we need to do the conversion again. Now it's not going to be that far off, but it is best to do the conversion, and it's honestly best to not do these min-maxes, but I wanted to show more of the process than actually review in detail the food itself like we normally do. So as you can see, the dry food has way less moisture, so we're only 10% versus the 70% in the can. And then we are going to start at the top. The protein they're listing at 31, the fat they're listing at 12.5, fiber 2. They did list a linoleic acid. The calcium is at 0.8, which is actually pretty impressive if you've been following along for a grocery store brand. 0.7 on the phosphorus, and then they didn't list the magnesium. I don't have a thing here for magnesium because I don't usually do magnesium, but we'll add the magnesium and the taurine in. And then they listed an omega-6 fatty acid minimum. I believe we're looking for omega-3s. So there is a difference between 3 and 6. They're doing at 1.6% of the 6s. I would like to see what the 3s are. So that is not going to be evaluated on this one. There is a difference between 3 and 6s, and the ratios are important to check the textbook for more in-depth. My little workbook and these videos are for the beginner, and so sometimes when you get into fatty acids and the difference between omega-3s, omega-6s, and the importance of the ratio, that's kind of beyond these videos. And so I would, if you are really into that, I would dive into that textbook, which is more of what like we learn in veterinary school versus kind of the oversimplified version that I give you guys just for a taste of what we're talking about. And so we're good on the protein. We at 34% correction, that's great. The fat, we're at 13. And so just according to our small animal clinical nutrition, because the fat isn't that important for urinary health, but it is important for your overall health, we are good on that. Fiber at 2.2, we are good on that. Calcium at 0.88 is excellent if your cat has urinary stones, and to be quite honest, it's quite excellent even if your cat does not have urinary stones, because we can go up to 1 on that. The phosphorus at 0.77. Again, just for your everyday regular cat, we are good. But if we are specifically trying to eradicate crystals or be proactive about our crystal formation, that is good as well. Let's pop in here the magnesium number, 0.08. is going to correct to very similar, 0.09. So we are good on the magnesium. And then the taurine are at 0.15. That is going to correct 0.16, which is perfect. So this food, as far as the nutrient parameters go, spot on. It's a dry food, okay, and we're still waiting for the information about the can. It's a dry food, so that is a little bit of drawback on this one. Ideally, we would want can. But I would say it's more important, because people ask me this all the time, is it more important to feed can, or is it more important to feed a diet that is appropriate on the parameters? I think it's more appropriate to feed a diet that's on the parameters, because we can do other things to beef up the moisture, okay? Ideally, you would find the one that's the best of both worlds, but that's not always possible for various reasons, budget, etc. So I would always go with the nutrient profile. All right, they're getting back to us on the pate. Okay, perfect. Thanks, that's what we needed. So the Purina ONE brand urinary, the pate, and that's dry matter. I'm just going to verify. So calcium and phosphorus on the pate are going to be, they're going to be a little bit over. So you do get the added benefit for the moisture, but you are not quite spot on with the calcium and phosphorus in the pate. And so budget-wise, you gotta pick and choose here, unfortunately. And so for this one, it may be the better option if you can to potentially do the dry and soak it in water, or do the hydrocare, do some fountains, or do something else to increase moisture content. So that was the Purina, which is the budget option. The next one that we're going to be doing, and again, this is just to show you guys where you need to be looking and what you need to be looking for and the process. The next one that we're going to be doing is going to be the science diet. I'm just going to pick the next screenshot that I have here. Okay, so here we've got the science diet. This is the new one. This is the urinary and hairball. You can see, what the heck? You can see here that it is, the as-fed is going to have a high moisture content. Where does it list it? I don't see where it lists the moisture, but it's high moisture content because the ad-fed's only 9.3, and then they jump over to the dry matter, which is 36.3. And so we're going to be using the dry matter column, but this is for the canned diet. So as we go through this one, we can see that the protein is correct in what we want for specifically urinary range. The fat is correct for just your general cat range. Let's pop those numbers up here just to remind us what we are looking for. We can, there it is, normal cat range. We want our fat to be between 10 and 30, so we're good there. Carbohydrates, people ask me about that all the time. I'm going to do a video on carbohydrates. There's just a lot of data to present. I'm trying to figure out how to present it in a way that's not too, that's for all levels. And so it's a little bit difficult when we start getting into that. But in general, carbohydrates need to be 35%, should be around 35% or less. People always send me, well, the foods are so high in carbohydrates. And I'm like, what numbers are you using? Like, are you just saying that, or do you actually know the number? Because the number is 35%. It's not well researched, but we know that they do really well at 35% or less. The data shows that. And so the magic number on carbs is 35%, and so this is well below that, 26.3. So you're fine on carbs on this. But most nutritionists agree it doesn't really make a difference in the general patient. Now, if your pet is diabetic, managing carbohydrates can help manage the diabetes, but increased carbohydrates in dogs and cats does not cause diabetes. And so again, I can understand that could be a little bit of a difficult concept to understand. And so that's why I have not done that video yet, but 35 is the number. So if you want the number, and again, I go over that in the cat book, the number is 35. Fiber at 9.2 is nice. It's a little bit of a higher fiber diet, which is good because, again, we want to prevent the constipation. A lot of people get kind of confused with urinary blockages. So 9.2% is kind of above what we normally recommend for fiber, but increased fiber in the cat I think is a good thing. Calcium is 1.03%. We wanted it to be no more than 1. I never deduct for like 100th off, so the calcium is right there at the top of the reference range. The phosphorus is within the reference range. The potassium, we're not looking at that one. The sodium, it needs to be between 0.3 and 0.6. They're at 0.34, so we're good there. Magnesium at 0.068. We are good there. It's actually right at the very bottom range of the reference range. And taurine, again, is in the good level. They do list their omega-3, omega-6 fatty acids. You could calculate the ratio if you wanted to, but we were trying to aim for omega-3s between 0.35 and 1. Wanted to make sure that I didn't typo that wrong. No, it is a 0. It is the omega-3s that we are supposed to be looking at. I was having a little freak out moment. I was going to have to do a different re-edition in my book, but no, that is correct. So they're a little bit low on the omega-3s. It's pretty close, but they're a little bit low on that. So most of the boxes are checked with this one. This one is, again, a canned diet, so this would probably be a better option than the Purina ONE option because the parameters are most closely tailored for urinary health, but also in a canned version. Let's check out the dry version really quick. So protein, again, we are good in that range. Fat, we are in that range. The carbs, we are low, 32.1, so we are lower than the 35%. We've got that fiber up there, which is what we wanted to see for that constipation. I think that's a good idea there. Calcium at 0.74 is that less than 1, so that is perfect. Phosphorus at 0.6, low phosphorus. We want it less than 0.9. That is perfect. Sodium at 0.35 is again in that range, 0.3 to 0.6. Magnesium between 0.07 and 0.14. We are on point there. This vitamin E is amazing at 700. How many of you have been with me? Raise your hand. 700. That's amazing. You're going to really have that antioxidant effects, that free radical scavenging you need for a cat that has chronic cystitis. Some of these companies are putting in this little wimpy 45, which is the minimum. That's not going to do it. 100, 200, 300, even 400 is not going to do it. We need that 5, 6, 700 for optimal benefit. So there we are with that. And the total omega-3 fatty acids were much better in this one at 0.35 or 0.58% when we want between 0.3 and 0.6. So for right now, I'm going to say, again, the dry is a better option. I feel like the Science Diet is a better option than the Purina version, but again, we have to factor in price and availability and things like that. So you guys do your own personal calculus. We're not really picking winners or losers. I'm showing you where to find the information so that you can make the best decision for yourself because everybody's situations are different. The last one we're going to do today is Medicus, and this one's kind of an interesting one. I know that Glenn on his channel, the Pet Food Puzzle Guy, did a nice review on Medicus. He doesn't particularly like the brand because the marketing is sketchy. And I would have to agree, some of the marketing is sketchy, but he does note that the nutritional profiles are kind of on point for a lot of their diets. So I had started to do a review on them a long time ago, and it just got really convoluted, and their website's kind of not great, and there were some discrepancies on what they were reporting, and so I kind of stopped. But I know a lot of people kind of shy to them for prescription type things, and it's one of the fresher foods and all that, so I wanted to do a like fresh food option because we did some dry, we did some canned. Canned's a nice alternative if you don't want to do the little burnt brown balls, although the little burnt brown balls were better nutrition than the canned in these instances, but I know a lot of people don't want to do that, so I wanted to throw one in there that was a little bit different, a little bit holistic, and actually one of the more expensive varieties as well. And so this is the Medicus Veterinary diet for urinary health in the cat. Their website, you can see you've got the macronutrients here that had a drop down. You could select, these are all on a dry matter basis. We have the vitamins, the minerals, and the amino acids. And so we know, based on the information that we've been going by, that we want the protein between 32 and 45, and they have done it, 41.95. We've got the fat nicely situated between 10 and 30, so at 23%. Again, they're going with the high fiber as well, so we're okay there, even though technically, yes, it should be less than 5. I like the higher fiber. We've got the net carbs at 20.46. This is really important here. This was one of the reasons why I stopped my review, because I was just so aggravated. You got to watch this word right here, net carbs. Okay, net carbs aren't total carbs. The Science Diet and the Purina are listing total carbs. And again, I don't want to get into this. This is why I got aggravated with them before. The way they were reporting things is a little bit shady. Net carbs is your total carbs minus your fiber. It's not your total carbs. And so this is actually probably close to 26% and not 20%. So that's a little fuzzy math, and I didn't like that. But this is net carbs. Either way, it's going to be less than 35%, but I don't like the way that they're reporting this. They're reporting this in such a way they know that you guys aren't going to pick that up. And they're saying, oh, we're really low. And they even had some charts where they showed, like, here's what Science Diet has, and here's what this has, and this is what this food has. Again, that smearing tactic. But they're showing total carbs on those diets, and then they're showing theirs as net carbs, which is not the same thing, and it's very deceptive. Anyhow, it's less than 35, so if you again are looking for that golden number, it is okay there. They are using the omega-6 omega-3 ratio is 62:1. Don't have the exact number, so we aren't going to be able to evaluate that. Right here, I was talking about the wimpy vitamin E. The vitamin E is at 13.74. I mean, compared to the Science Diet 700 plus, this is just absolutely like minuscule. It's even less than a 45, which is usually what AFCO wants. So that number there, super wimpy. This super expensive diet, you're not getting that nice vitamin E scavenging ability there. At 13, that's just absolutely negligible. Minerals, calcium, we are good, 0.67. Phosphorus, we are good, 0.59. You got the ratio there. Again, a lot of people look at the ratio. The ratio should never supersede the absolutes. There's some science behind the ratios. You can check the clinical nutrition text for more information on that. That's kind of beyond the beginner entry-level nutrition enthusiast. So we're not going to be talking about the ratio. Skipping down to the sodium, 1.29 is too high, 0.3 to 0.6 is ideal. Some of these diets will try to dissolve stones and try to use a dilute urine to flush things out. They're doing that. The problem with that philosophy is if you have a cat with heart disease, and heart disease in cats is largely gone undetected until they unfortunately die of catastrophic event. Their hearts are very small. It's hard to auscultate murmurs. And so increasing the sodium is not the greatest plan, but it is utilized in some prescription dissolution diets. And we'll talk about those in a minute. The magnesium is at the upper level at 0.14. And then you got to be careful here. See, this is manganese is different than magnesium, so do pay attention. Some people may say that, oh my gosh, their magnesium is 9.66. No, this is manganese. What you want is magnesium. And then we're going to get down here to taurine, and this is what I thought was interesting. Their taurine is at 0.04%. That is very low. The taurine, essential amino acid in the cat, they need it for their heart health and function. They cannot synthesize it like the dog and other species synthesize it. They have to have it in their diet. 0.04 is well below the 0.1 to 0.2. And so I actually emailed the company because that was really concerning to me. And I wanted to know the situation with that. They did get back to me pretty quickly. Let me pull up the email here for documentation purposes. Okay, so I emailed them, very responsive to my questions. The first person said, great question, and they had to pass this on to Dr. Besant for her expertise on the matter, why the taurine was so low and below the recommended range. It says they heard back from Dr. Besant, and she said the reason for the low taurine is due to the need of adding rice to the diet and keeping the overall minerals low. So in order to do that, as to not provide the substrate for crystals or bladder stones. So again, keeping those minerals low does not allow the substrate for those crystals and the bladder stones to form. So this diet is a prescription diet, and so it is not recommended for long-term feeding. So once they're doing better, then you want to switch them over to the Simple Food Project recipe. So they want you to switch them over to a different diet, and he listed them there. Yeah, so it doesn't give an exact time frame. It does say that the bladder health diet does require prescription, and because they want to get the kitty better and then switch over to this other diet, but it doesn't say how long you are meant to feed that diet. The problem is a lot of these cats, especially with fluted or these chronic conditions or chronic disposition to forming stones or chronic disposition to urinary tract infection, they do need to be on it their whole life. And so I know a lot of the things that I've seen with the Medicus and some of the veterinary people that are against prescription diets are like, well, you only need to be on the prescription diet for a small period of time, and then you need to switch off. Yes, if the diet is formulated like this, where it's deficient in taurine, you absolutely are going to have to switch off. But if you use a prescription diet that is formulated properly, they can safely be on it for the rest of their life, which is what a lot of these cats need. Diet management is sometimes the only thing we can do to manage these. So what I thought I would do, and I just thought about this, now I'm going to pull up CD, which is the Hill Science Diet version. Full disclosure, this video is not sponsored. I'm not getting paid to do it. I will tell you, CD is one of my favorite diets for urinary tract health in cats. I have seen it do wonders. I have seen it save cats' lives that are, people are like, I can only unblock this cat one time. I cannot afford to do this over and over again. We need to do something because if this happens again, this is just going to be the end. And so obviously I don't want to hear that. And so I need some sort of a tool, and there aren't very many of them. And I have been very successful with CD in preventing reobstruction or restone formation, because they have said also, I can't do another bladder stone surgery. This is very expensive. It's very taxing. I can't continue to do this. And so we need something to help them. And I've seen this diet be very successful, and it does not use the high sodium methodology like some of the other ones. So like Royal Canin SO, I believe, uses the higher sodium situation, and the Purina UR uses higher sodium. We can do it side by side on the prescription diets, but I don't like to get into prescription diets on these videos because that really depends on your veterinarian. That's a conversation. It's a prescription. It is what they think is best for your pet for their disease, so I don't get into it. But I just wanted to point out that there are prescription diets out there, because I know a lot of people feel so guilty, and I thought, I feel so guilty. I felt this prescription diet, and they say I should only be on it for a short amount of time and then I need to switch. Well, yeah, that's true about their diet. The way they formulated their diet. But there are other diets out there that are perfectly fine to stay on the entire time, and your pet will be healthier if they're not in a constant state of inflammation, pain, and infection. And so you have to weigh all of those things. That is the true definition of a holistic approach. We may also have your pet on pain medication. We may have them on a glucosamine supplement. We may recommend them some integrative care, so acupuncture, herbals. We may have an entire regimen that we're using, and so it's the total approach. It's a truly holistic approach to medicine, is using all of those factors. So let's do the CD Multi-Care Cat. This is a prescription diet. Why is it prescription? I don't know. I don't get into all that. I'm sure there are reasons for it, and it may be that it started out as prescription and then they've perfected it such that, et cetera, et cetera. I don't know. But let's just do, for instance, this CD, which is meant for dissolution, management, and long-term maintenance of stones and urinary tract disease in cats. So protein 33.9, that's good. Fat at 16, that's good. The carbs are higher in this, okay? So we are above that 35%, but let's see what the trade-off is going to be, okay? Crude fiber 1%, so that's good. Calcium 0.8, that's good. Phosphorus at 0.8, let me pull this back up, that's good. We got the sodium here, so we're at lower sodium at 0.39, that's good. The magnesium at 0.08, that's good. The taurine, look at it right here, 0.21. And then again, our vitamin E, whopping number here, 746. And your total omegas are going to be good at 0.67. And so that was a lot of information. Feel free to ask me comments in the description below, but the long and the short of it is you have the chart, you have the information. If you have the book, you physically have the chart and the information. You can procure it from the Small Animal Clinical Nutrition that's linked for free if you don't want to purchase the workbook. You have the information. You can go through these diets and you can pick the one that is appropriate for you. So if you're like, well, I really like the Medicus, I like the Fresh, I want to do that, know that you can only do that for a short period of time. That short period of time is not disclosed. So if it takes your pet 6 months to get through the inflection, the inflammation, etc., let all that die down, is 6 months okay with a taurine deficiency? I don't know the answer to that. And so that would make me personally as a veterinarian very worried. And given the light that there are other options that are better formulated, I would probably just say pick another one. So any of you guys out there have a fresh diet or a freeze-dried diet or one of those other preparations that you prefer that is potentially a contender, let me know so that we can give people options. I just want your cat to have the best nutrition. And if I have to go through all the formulations, because everybody has a preference that's different. If I have to find the right formulation for you, or you come with a formulation and I can help you find the right formulation that's going to make you consistent and make you successful, ultimately that makes me successful and makes your cat successful. And so that's ultimately what I want. So if you have another option that is along the lines of Medicus, Fresh, etc., but actually meets the nutrient profile, let me know, and we'll do a little part 2. This was a really long video, but I hope you enjoyed it. Enjoy the rest of your day and enjoy your newfound knowledge. And yeah, get the workbook. Enjoy life. See you guys later.